everyone, and welcome to our final week together. This is Joni Gaynor, and I just want to say thank you for working with me this whole term. I hope you enjoyed the course and these presentations. And this is our final one. We will piggyback off of what we talked about last week, and this week we will talk about treatment of psychological disorders. So psychological disorders, as we talked about a little bit last week, they do impact our lives and they play a significant role in both our physical health and our well-being. And understanding these connections, it is really critical to making sure that we find the appropriate treatment approach. For example, stress and anxiety. High levels of stress and anxiety, they lead to both physical issues like heart disease, blood pressure, and weakened immune system. Depressive disorders, they can impact our sleep, our appetite, and our energy levels, which then impact our overall physical well-being. Emotional regulation, managing those emotions, boy, they can contribute to our unhealthy coping mechanisms like turning to substance abuse, overeating, or even just a lack of physical activity. And then there's social connections. These are our strong social support and connections that we have, and the healthy relationships that are linked to them. They help us to be better physically as well as mentally and overall well-being as well. So types of psychological disorders, we talked about mood disorders. This has to do with that persistent feeling of sadness, hopelessness, euphoria. Think of this one as like our depressive disorders that we talked about last week. We've also got anxiety disorders. These have to do with fear, worry, anxiety, or GAD, the generalized anxiety disorder. We probably would also put social anxiety, panic disorders into this category as well. We've also got trauma-related disorders such as PTSD, acute stress disorder, and this can cause intrusive thoughts that lead us to avoidance or hyperarousal. OCD and related disorders, that like dissociative disorders that we talked about last week. These have to do with body dysmorphic disorders would also fit here, and these impact our daily lives as well. Lastly, our personality disorders, conditions that are marked by inflexible and maladaptive pattern of thinking, feeling, and behaving, such as borderline personality disorder, narcissistic personality disorder. And these do definitely put a strain on our relationship and lead us to emotional distress. All right, so the causes of some of these disorders have to do with with several factors. One can be genetics. And this can be done where we have a genetic predisposition, for example, where that gene carries it through. Schizophrenia, bipolar, and depression are good examples of psychological disorders that can have genetic factors leading them to pass down generation to generation. We've also got brain chemistry imbalances. This has to do with, for example, serotonin, dopamine, neuroepinephrine, and various neurotransmitters in the brain that are imbalanced can lead to disorders such as depression, anxiety, and OCD. The environment also plays a role. This has to do with trauma life events that we may be experienced, chronic stress, or exposure to just an adverse environmental conditions. These can definitely lead to PTSD and anxiety disorders. Substance abuse, the effects of alcohol and drug abuse, even from like prior to birth, for example, or in the womb, in uterine, that can definitely play a role. And then childhood experiences. These are those negative experiences such as abuse, neglect, or attachment issues, and these can contribute to the development of personality disorders or trauma-related disorders as well. All right, so diagnosing these disorders. We've got a comprehensive evaluation that takes place where we look at medical history, symptoms, as well as looking at the notes from social workers and various mental health therapists and psychiatrists. And then we've got some diagnostic criteria where we will look at the DSM, which is the Diagnostic Statistical Manual of Mental Disorders, as well. Sometimes we will look at the ICD, which is the International Classification classification of diseases, and we will compare that to various symptoms that the individual is experiencing, and this will help us to get a diagnosis. We also look at psychological assessments. These have to do with interviews, reports, subjective and objective questionnaires and surveys, as well as just getting information from the individual about what they're thinking and the feelings that they are experiencing. Physical exams also lead us to some great information. We look at various underlying mental conditions, medical conditions rather, that can contribute to why the person is experiencing those symptoms. So it is a multidisciplinary approach, looking at all these various parts to help us get a true diagnosis. Psychological therapies. So about 75% of the time we will rely on CBT, which is cognitive behavioral therapy. We also rely a lot on mindfulness-based therapies, as well as psychodynamic therapies and interpersonal, which is known as IPT, interpersonal therapies. All right, various medications can be used to treat these disorders. It really depends on the type of treatment as well as how the individual responds. So for depression and anxiety disorders, we tend to rely on SSRIs, which are selective serotonin reuptake inhibitors. For anxiety disorders and insomnia, we tend to rely on benzos. We've got bipolar disorder. That's where we tend to rely on mood stabilizers. All right, and lastly, for schizophrenia or other severe mood disorders, we tend to rely on some antipsychotic medication. So looking at a holistic approach is certainly an approach treatment that should be considered. This has to do with looking at the mind, the body, and the social environment and the interconnectedness of all of these, and addressing the various aspects that are leading toward these symptoms and looking at the long-term well-being. This is a comprehensive perspective, and it acknowledges the complex nature of the mental health as well as the need for a multifaceted intervention. So for example, you may focus on getting treatment for different aspects of this, anywhere from the workforce, spiritual wellness, physical, such as working out, emotional wellness, learning how to regulate your emotions. All of these play a role in having a holistic approach. All right, support systems. They are so important. There's various types of support systems, and each one plays a crucial role in treatment. Family support, this has to do with both financial support as well as emotional and practical support for individuals who are experiencing psychological disorders. And this really can improve treatment outcomes and overall well-being. Friend networks, finding supportive friends that help reduce that feeling of isolation, help provide a sense of belonging, and encourage participation in treatment activities. Peer support groups, joining a support group that others may be experiencing similar symptoms or similar issues and struggles. This can really offer a sense of community and shared understanding, and look for some opportunities for mutual encouragement and advice. We've also got therapist-patient relationship. Finding a therapist that you can work well with is super important. Making sure that you have a good dialogue with them, it really is a crucial component for finding an effective treatment. And then also finding one that you feel safe and trusted with, and have an open dialogue of communication is important. Lastly, looking at community resources. There's lots of community resources out there. There's hotlines, support groups, and there's a lot of community-based groups, and there's also faith-based community groups that will help to supplement the professional treatment that the individual is receiving. Also want to talk about self-care, making sure that one way of improving our mental health is increasing our energy and vitality through working out. This can be things from meditation to yoga to lifting weights, jogging, anything like that. Also taking care of our nutrition needs, reducing our symptom severity, making sure that we are in check with those symptoms, and also enhancing our treatment outcomes. All right, so recovery and relapse prevention. This chart is a little bit dense, and so basically what this has to do with is there's several factors that contribute to recovery and relapse prevention. Abstinence from those substance abuse, so staying away from alcohol, tobacco, and drug use, for example. Also developing coping strategies. This means where you actually get some tools in your toolbox to help you when a trigger for PTSD, for example, is comes about. It helps you to prevent having a reaction for that trigger. Rebuilding relationships, mending and strengthening interpersonal connections, and working on those damaged relationships as well. Improving your self-care, making sure that you take care of yourself, give time for yourself, not just avoidance, but actually not avoidance of the situation or the trigger, but actually having some time to be in touch with your emotions, your feelings, as well as doing things that make you happy. Addressing those underlying issues, making sure you look for those root causes of the disorder, of the trauma that maybe occurred, or the any of the abuse or anything like that that may have occurred, and addressing it. Motivating, maintaining motivation. This has to do with really cultivating a strong commitment to the recovery process over the long term. Just like anything that you are working on recovery from, there is an up and down effect of recovery. So we want to make sure that you are in for the long haul and maintain that motivation. Seeking ongoing support, we talked about this, can be community support, support with your family, support from therapists, community groups, all of those things, but making sure that that support is ongoing is critical. And then also, lastly, is just developing a comprehensive plan that identifies and manages high risk situations so that you can be prepared with some strategies in those high risk situations, avoiding them, or having those support systems in place if you do need to encounter them. I just love this quote by Demi Lovato talking about mental health awareness as an important physical health awareness, and that the more we talk about it, the more we can reduce the stigma. I think that's why it's so important to have presentations like this and have courses like this that really do talk about mental health awareness. Okay, in conclusion, I want you to focus on comprehensive treatment is essential, looking at a multifaceted approach, which includes both cognitive behavioral therapy medications as well as lifestyle changes that need to take place, and finding those long-term support systems that will help and promote long-term recovery. Addressing the psychological as well as the physical aspects. Both play a role. So we need to look at addressing both of those as well as any underlying physiological contributors to the mental health crisis that you may be experiencing. And then lastly, just having an importance of patient-centered care. This really has to do with making sure that we are aware of the cultural background that is so important for achieving those positive outcomes and improving quality of life. So looking at this and promoting a holistic type of treatment plan is so critical, and it is important to bring this to your attention to share awareness and make sure that we talk about mental health awareness. If you have any questions, reach out to me, Joni Gaynor at fortiscollege.edu. Thank you.